Hi, welcome to Healthy Minds, a show where we talk about mental health issues. We're your hosts, LaShawn McCautry.
And I am Ronaldo Moody.
And we're going to be talking about 5150, that process where someone is in psychiatric crisis and what happens at that point. So let's talk about that whole process of 5150. And I know that there are a lot of different parts to it. And so help us and explain to us kind of the details about that.
Okay, I mean, there's a lot involved in it, but
Right.
let's just give a quick overview to get some understanding. I really want to focus on the patient's rights here.
That's a good one.
I really want to focus on how it's not, you're just not locked away in prison, you're not coming back.
Good.
It's nothing like that.
Yeah.
After you're 5150, it's a 72-hour hold where they get psychiatrically,
Right.
where it's a psychiatric evaluation.
Right.
After the psychiatric evaluation, which is 72 hours, if they still need help, if help is still needed, the psychiatrist has the right to say, look, this patient still needs help. We're not going to let them out when they know there is a danger to themselves or others or gravely disabled, which we could talk about later.
Yeah, let's do that.
And what they will do is they will certify them on a 5250.
Whoa, all these numbers,
I know a lot of
5150,
numbers,
5250. Okay, so so 5150, the 72-hour hold.
Yes,
And
yes.
if they still need they still need help
Yeah,
and
they need
treatment,
treatment, yeah.
then we go to 5250.
5250, yes.
All right. Take
So-
it away, 5250.
So 5250, if 5250 says that this person can be held
Okay,
for an additional 14 days.
wow, okay.
Now, they're in a hospital setting, they're being taken care of, they have mental health professionals around them 24 hours a day, they have a psychiatrist looking after them, they have the help and they have the support system that they need in order to get better. So that's very important, that 14 days.
Okay, I have a question.
Okay.
So let's say I am that person
Okay.
and I recognize that I do need the help and I am willing to get the help.
Great.
Does that make a difference?
That makes a huge difference.
Okay.
Because now it's voluntary.
Ah,
That's a huge difference. When
Okay.
you go in
Okay.
and on your own accord.
okay.
And as long as you don't continue to be a danger to yourself or anyone else, then you can leave whenever you want, as long as the doctor says that you're fit to leave.
Okay.
That's voluntary. But now the 5150 and the 5250 is totally different. That's involuntary.
Right. That's if I need help, but I'm like, no, I'm good.
Exactly.
Kind of like that. Okay.
And that's when either the police will be involved or a mental health professional will be involved.
Right.
And it sounds bad, but it's when you are being held against your will.
Right.
It sounds bad, but it is really for the safety of that individual and the community
And others.
at large.
Okay. So then with the 5250, kind of explain, is there hearing? Like who determines that I need to be there?
Oh, yeah.
And, so tell us about that.
Well, there are a lot of checks and balances, and there are a lot of rights that the patient has when you're involuntarily held.
Right.
So there's what we call a patient's rights advocate, and the patient's right advocate, they actually really look into how this person was held. They look into if this person was held for the right reasons, if it was documented correctly. They actually work in concert, hopefully with the family, the psychiatrist, and the mental health professionals to make sure their treatment is a holistic treatment and their rights aren't being taken away from them.
That's so important, and I'm glad that actually exists.
Yeah.
So there's a patient rights advocate, and what else is involved in the 5250 process?
Well, after the 72-hour hold, which is the 5150, the 5250 says that within 4 days, some kind of like a court process needs to
Right.
take place.
Okay.
So there is a hearing officer, and a hearing officer sits with a representative from the hospital, and a hearing officer also sits with the patient's rights advocate, and they have like a kind of a mini court session.
Is the patient there too?
The patient is there too. The patient can be there. It just depends on the situation.
How they're doing. Okay.
Yes. And the hearing officer will determine, after looking at the records from the patient's rights advocate, after looking at the records from the hospital, they make sure that all the documentation's in place in order to make sure that this person's rights was not taken away from them.
Okay. You know, I've worked with the mentally ill population before, and I have seen where someone was placed on a 5150, 5250, had the hearing, and as a mental health clinician, you know, your staff was like, they're going to be in there for a while, but all of a sudden, I guess they did well in their hearing, and they're out. It's like, whoa, how did that happen?
Well, like I said, there are a lot of checks and balances, LaShawn. A lot of checks and balances. It's not like you get sent to a hospital and you never see it anymore ever again.
Right.
It's not like that.
Right.
There are people in place, and the system puts people in place to make sure that not just one person can say, you can't leave. It's not like that anymore. There are many different people that we collaborate, mental health professionals that we collaborate with, to determine whether or not someone is fit to stay in the hospital or not.
Okay.
So with the 5250, there's the hearing officer, looks over the record, the patient rights advocate advocates for that patient.
For the patient.
And the hospital representative, they're the ones that says, look, this is why we think this person should stay in the hospital.
Okay.
So there's a lot that goes on.
Yeah.
And
yeah.
there's a lot that protects patients'
the patient,
rights.
Yeah. And so if they're doing well, then they can essentially, you know, they can be released, or the hold would not be upheld if they're doing well.
The most important thing to remember is that there are only 3 criterias in order where people can be held against their will. There's only 3. You just can't be held because you're having an anxiety attack, or if you're having a panic attack, or you're depressed. No, you're not held for just for those reasons. There's only 3 criterias that you have to meet. And those 3 is, 1, you have to be a danger to yourself, and that has to be immediate or imminent. It means that it has to be going on right now.
Right.
And then the second thing is you have to be a danger to other people. Psychiatrist is not going to let people out who might hurt someone else.
Correct.
Okay? Or you have to be gravely disabled.
Gravely disabled. Tell us about that. What does that mean?
Gravely disabled says that because due to a mental health condition, you can't provide food, shelter, or financial support for yourself. Okay. That's gravely disabled. And what's interesting is that a lot of people think that you can be put on conservatorship if you are a danger to someone else or a danger to yourself. The truth is that you can only be put on conservatorship based on gravely disabled.
Wow. Okay. Right. If you can't support yourself, can't really help yourself, that can lead to conservatorship.
Yes, that can lead to conservatorship. Now, there are other factors that play into conservatorship. You know, if someone is a danger to themselves or danger to other people, there are special situations where they are put inside a hospital for that for long term. But that process is different. But for our purposes and what we're talking about, gravely disabled is really about if you can't provide food, shelter, or financial support for yourself, and for long term, if the hospital or the psychiatrist finds that that is due to a mental illness, then you could be put on conservatorship.
Okay. Well, we thank you so much for explaining this process to us. We appreciate that.
Oh, thank you for your time. I love it.